guess a little bit of an introduction about me. I've been building this practice and have been really trying to fill the needs of what I was seeing from my patients during my psychiatry training and my work in outpatient psychiatry prior to this. So I am originally from the Midwest. I was a football player and was very much into high school football. We had a great team, and so afterwards, I actually decided to stay on for a little while and coach as a high school football coach. And that was sort of my first taste into like working with younger people with dreams and ambitions who are just running into problems and wanting to help them work through that. I went on to the University of Notre Dame for undergrad. Similarly, after getting into medical school, I was a resident assistant and was approached by a lot of freshmen and sophomores all stressed about their pre-med classes, and found myself giving a lot of advice about that. I went on to Brown for medical school, and there I did some medical school admissions advising privately with a former faculty member and an admissions person. And so again, kind of like really working with younger people. I also was a mentor with Big Brothers Big Sisters, and really enjoyed that. And then around that time, I began reading books by David Burns, who's a well-known cognitive behavioral therapy expert. And so I went and did a CBT certification with him out at Stanford. And I realized I just had this love for CBT, for psychology, and merging that with medicine. And so that brought me to do my psychiatry training at Cambridge and Harvard Medical School. And that really is where I saw that there's different ways to practice psychiatry. There's definitely folks in psychiatry that prefer more of a med management model. There's definitely folks that prefer more of therapy. And for me in particular, I loved therapy and I loved medicine. I loved integrating internal medicine, functional medicine into my work. I love having long appointments with people where we do it, really where we check their blood levels, look at things like their thyroid function, any signs of insulin resistance or vitamin deficiencies, and make sure there's nothing like that contributing to their symptoms. And then mostly doing a lot of strong therapy work. And so through my time at Cambridge and then at Boston University Center for Anxiety Related Disorders, CARD, I've gotten experience in exposure therapies for OCD, for anxiety disorders, CBT, unified protocol, mindfulness. So these are the sorts of things that I like to do now. So I'm building this practice that is a concierge practice where basically my job is just to help you, the family, take care of the kid, to do everything that I can from a psychiatry, psychology, and health perspective to help the kid to succeed. And so it allows me to tap into these different tools from therapy to medicine, to college, advising, admissions, and things like that to put it all into one practice.
And I think the thing that we had talked a little bit about when we first spoke was ideally trying to keep individuals within the community and keeping them kind of moving forward. And
Mm-hmm.
I think that as a society, many times it's like, oh, if you're, not feeling well, if you're suicidal or whatever. But I just think that I have so many students that go from hospitalization to hospitalization, and they don't really learn the tools necessary to stay in their community, to stay in their environment. And it does sound like that's what you're trying to really do, increasing their tools in their skill set so they can kind of live a healthy, productive life with the appropriate tools by practicing what they need to be successful.
Exactly. I mean, a lot of people have been in exactly the situation that you were just describing, which is going from hospitalization to hospitalization or into a partial hospitalization program. And one of the main issues with that is that there's this change in hands of providers, right? And they don't have a consistent therapist or a consistent psychiatrist that's by their side throughout this to sort of give this, just sort of consistent support and a consistently updated approach. So that's one problem that I'm trying to solve. The second thing I would say is that, right now, unfortunately, there's really long waits for psychiatry and for therapy. And so people, they'll be having problems right now and they are on a wait list and they can't see anyone for 3 months. And when they do see someone, they find out it's just like 15-minute visits once every like 1, 2, 3 months. And so, in the concierge model that I do, it's sort of the opposite of that. I'm there and very much available, and typically it's hour-long appointments on a weekly basis. Because it's a concierge model, there doesn't need to be billing for sort of extra time, extra support if I'm talking to parents on the phone, talking to counselors at the high school or at the college. So it allows me to really dive in and give a lot of care and support. It does mean that my practice needs to be smaller though, and that I'm not able to help a ton of people. But certainly, as hopefully it continues to grow in the future, hopefully I can expand that access more. It's really all about just trying to give that support and give those tools, I think is what you were touching upon. One of the sort of illnesses I focus on is ADHD. And I think a lot of people are frustrated when it seems that their only options for ADHD are Adderall or Ritalin or Vyvanse or Concerta or Focalin. And so, these medications can have some benefit for some people, but a lot of folks realize that, hey, I think it would probably be good for my kid to learn like how to make a schedule also, like the Adderall's not going to fix that. I think it'd be good for my kid to also like keep to-do lists and know how to prioritize what to spend their time on. And so that was actually my research focus, is on behavioral approaches for ADHD. So that involves cognitive behavioral therapy for ADHD, which involves a lot of calendar management and calendar hygiene, task lists and task prioritization. And then I also use softwares for attention training and working memory training. So those are some, some behavioral tools, some non-medication approaches that really give these young adults skills to help them to be successful.
So I feel like I have so many students that are struggling with that disability, but typically it's overlap with many others. But do you ever do consultations with school to kind of maybe help the students generalize some of the tools that they're working on outside of school with you?
Absolutely. Yeah. I mean, in general, the involvement with schools is something that is hit or miss, kind of depending on the school, depending on who you're working with. Some folks, are very open, very available, and other people it can be hard to reach and hard to coordinate with them. But it's certainly something that I'm willing to do. A very important part, of being a psychiatrist is and doing this work in student mental health is doing coordination with schools around accommodations, and so that's certainly something that I have experience with, and is sort of included as part of the service for
So
sure.
do you have any potential rule outs? It sounds like we could start with clients almost like I feel like sometimes it's like, oh, only ADHD, but I do know that how much that can really impact students in school. But I think maybe we had talked a little bit about like a potential rule out, like who would be your
Hmm.
ideal
Yeah,
client versus someone that you think maybe not the best fit.
yeah. So my training and background is in adult psychiatry, and then I've done a lot of student mental health work with students that are 16 and above.
Okay.
So certainly, younger kids, unfortunately, is not my specialty, but I have people who I can definitely refer to. I would say that, the focus of the practice is definitely anxiety disorders and ADHD, and depression. So at the BU CARD, Center for Anxiety Related Disorders, we have done a lot of work with social anxiety, with generalized anxiety disorder, with specific phobias, and OCD as well. And so certainly applying CBT and exposure and response prevention for those folks is a focus of mine and something that's really important to find in a therapist. And as a little bit of a tangent, I think, folks should be really considering, and especially in kids with anxiety disorders and depression, about the the therapist that they're choosing, and just finding the right balance of supportive psychotherapy and still exposure therapy when necessary. And sometimes folks can find that their anxiety symptoms worsen when they're in a supportive therapy that doesn't really push enough towards the exposures. So, but anyway, so the focus
Yeah.
is anxiety disorders as well as depression and ADHD. I certainly have seen people with bipolar disorder, schizophrenia, or other psychotic illnesses. Bipolar 2 or cyclothymia, I think, can be managed pretty well in a clinic like mine. But otherwise, that involves sort of some separate skills and some separate networks that I'm happy to help anyone with, but not necessarily a focus in my practice.
The kind of in line with the last question I think that I had asked, but what I find, I would say in the past, like, since 2020 anyways, is I do have a lot of school avoidance, and I
Oh, yeah.
have potentially school psychologists or people that are trying to do exposure therapy to, I mean, some kids are completely immobilized by setting foot back on, their school kind of campus.
Hmm.
Um, and sometimes my fear is that people potentially doing some type of exposure therapy without the appropriate training. So one of the things I do like to advocate for a lot of times, and I think it's cost effective, is having an expert such like yourself. Really, I'm not saying that you could teach them, but working collaboratively with potentially school adjustment counselors or school psychologists to say, this would be the way that I would go about it, as
Oh,
opposed
yeah.
to
Hmm.
forcing them out of the car and
Yeah.
dragging them in, and which can be much more detrimental. And I feel like essentially many times just almost forces the kid to never go back. And then
Hmm.
maybe they didn't need a therapeutic program if we had approached it in an appropriate way.
Yeah.
So that's something that I also feel like maybe a great resource for you is, in students' IEPs, there's this section for consultation.
Hmm.
Consultation can be to school members. And
Absolutely.
yeah, I think it's just a win-win in terms of if we were to keep a student in their own neighborhood school and trying to
Hmm.
go about it the appropriate way, as opposed to in a punitive way
Right.
or mental health issue.
Exactly. Yeah. I mean, in general, with any exposures, it's always good to generate intrinsic motivation and try to remove the extrinsic motivations or punitive sort of measures like you're talking about. And so that's a big part of the work that I do, is talking with the patients and being like, well, you could stay this way. Do you want to do that? Do you want to stay at home? And really driving out from, well, no, ideally someday I would like to be out there and socializing again. I would like to get a friend group again. And I do a vision mapping with them where we're sort of helping them to identify and really visualize their dream self, their ideal self, and then help them to move toward that. And the exposures can be then a powerful positive intrinsic motivation for them to move toward that ideal self, rather than something their parents are forcing them to do or the clinicians forcing them to do. So yeah, that's in general kind of one aspect of the approach. But I would be happy to talk with anyone or work with anyone as they're trying to think of a thoughtful way to do this with a student.
Yeah, I mean, I think my approach, and it sounds like similar to your approach, is really to build a team around the student based on their individual disability related needs. And when it
Hmm.
comes to the mental health piece, I do think sometimes schools feel like, oh, we got this,
Yes,
but it might take a level of expertise. Whereas if we just had someone like yourself consult with the school and maybe even providing some of these tips, I'm not saying that they don't have the skills, but it just has to be the right approach for that individual student. It's
that's right.
unique to everyone. So I wanted to take an opportunity to, I posted a little bit about you on some of my socials, but I also just wanted to hear a little bit more as you had talked about your ideal client. And then maybe you could just talk about how people can get in touch with you. And like I said, I will post this because I think your service is so valuable. And I just wanted to let my people know about what you do.
Awesome. Thank you so much for your support, Maureen. I mean, That's why I reached out to you, is because that team approach is so important. In my work, I need to get the parents involved, but oftentimes, ideally, if there's somebody like you, if there's an engaged school counselor, just really getting everyone on the same page, and helping them to support this the kid or young adult in the transition is really important. So yeah, I will. Anyone that would like to learn more, you can find out at www.nissenclinic.com. That's Nissen clinic, clinic.com. And there you can either fill out information in the contact us, or request an initial appointment. And I'm happy to talk with anyone, see how I can help. And yeah, I'm here to serve.
Thank you so much for taking the time to do more of a video format. I think sometimes that works for people. And then
Mhm.
I know that you and I will be in touch.
Great. Thank
All
you,
right.
Maureen.